Hello everyone. Very welcome guys. Yeah. So let's move on to some serious reading. Let's end cornea now here. Hi everyone. So अब हम लोग पढ़ने जा रहे हैं कॉर्नियल डिस्ट्रॉफी, ठीक है, and degenerative changes. Then we'll read some miscellaneous conditions, and then the surgery for cornea and eye donation and eye banking. We will end this and then only I'll stop the session. ठीक है. So corneal dystrophy में हम लोग क्या पढ़ेंगे? Corneal dystrophy are non-inflammatory hereditary corneal disorders which are characterized by bilateral non-vascularized corneal opacity. दोनों आँख में होता है, vascularization नहीं होता है इस dystrophy में. They mainly affect a particular layer of the cornea. कॉर्निया का पर्टिकुलर लेयर को अफेक्ट करता है. द वैरायटी ऑफ क्लासिफिकेशन सिस्टम हैव बीन यूज्ड इन द पास्ट. द इंटरनेशनल कमिटी फॉर क्लासिफिकेशन ऑफ कॉर्नियल डिस्ट्रॉफी IC3D established in 2005 has devised a current and accurate nomenclature supplementing the anatomical classification with updated clinical, pathological and genetic information. Now epithelial and subepithelial dystrophies क्या होता है? So these involve the anterior most layer of the cornea, generally present in adult, who may be asymptomatic and suffer from bouts of recurrent corneal erosion associated with pain, lacrimation, and blurring of vision, with varying extent of corneal haziness. Prominent examples in this group are epithelial basement membrane dystrophy, map dot fingerprint dystrophy, then Cogan microcystic epithelial dystrophy, anterior basement membrane dystrophy, Meesmann corneal dystrophy, MECD. Then we have juvenile hereditary epithelial dystrophy. Then we have gelatinous drop like corneal dystrophy. है ना? GDLD and subepithelial amyloid primary familial amyloidosis, ग्रेसन कहते हैं. सो बोमन लेयर डिस्ट्रॉफीज, ये क्या होता है? जो सेकेंड लेयर होता है ना, बोमन लेयर, उसकी डिस्ट्रॉफीज क्या होता है? दीज ऑटोसोमल डोमिनेंट डिस्ट्रॉफीज, सो ADM, autosomal dominant dystrophies usually present in the childhood with recurrent corneal erosions, gradual visual impairment due to corneal opacity, which are typically reticulate, honeycomb in pattern. Thiel-Behnke corneal dystrophy of the Bowman layer type 2, honeycomb shaped corneal dystrophy, anterior limiting membrane dystrophy type 2, irregular coarse geographical shape and opacity at the level of the Bowman layer and superficial stroma in Rees-Buckler's corneal dystrophy, RBCD corneal dystrophy of the Bowman layer type 1 and superficial granular corneal dystrophy, atypical granular dystrophy, anterior limiting membrane dystrophy type 1, granular corneal dystrophy type 3. Now histopathology shows irregular thickening of the epithelium with focal deficiencies in the epithelial basement membrane and replacement of the Bowman layer by fibrocellular layer with a sawtooth wavy pattern visible between the epithelium and stroma. Thickle buccal corneal dystrophy, a sheet of connective tissue with fibrillar or granular hyaline deposit of the protein that stain red with Mason trichome. The material deposited beneath the epithelium could be removed by blunt dissection, but it is now amendable to treat with the excimer laser by laser phototherapeutic keratectomy. Then we have stromal corneal dystrophies, ठीक है. ओ हाय एम के उपवाला, क्या है ये समझदारी इसी में है, इन सब लाइव वालों के पीछे टाइम वेस्ट। ओके, इट्स एज यू विश मैन। वी आर जस्ट रीडिंग ऑप्थाल्मोलॉजी, अगर आप इंटरेस्टेड नहीं हो यू कैन गो, और इफ़ यू आर इंटरेस्टेड देन यू कैन सब्सक्राइब, दैट्स ऑल योर विश नॉट माइन। ठीक है, देन वी आर रीडिंग अबाउट स्ट्रोमल कॉर्नियल डिस्ट्रॉफी। तो स्ट्रोमा जो होता है ना, कॉर्निया का थर्ड लेयर होता है। सो दीज अकर बाइलैटरली अराउंड प्यूबर्टी, they are of obscure origin, involving the central area of the cornea. Obscure origin होता है central position of the cornea. So what do they involve? They involve the central position of the cornea, corneal margin. Now, the lesion are characterized by the development of discrete areas of opacification, mainly in the superficial layer of the stroma, essentially due to hyaline deposit between the corneal lamellae. क्या कौन सा? ओ, कौन सा med? Okay, Shank, what do you want, Shashank? 100 mg capsule IP. You know ना, ईट्रा का 100 mg एंड एंटी हिस्टामिन ले लेना. नो, व्हाट? यू डोंट नो? ईट्रा का 100 mg ले लेना कैप्सूल में. एंड एंटी हिस्टामिन ले लेना 5 mg ले लेना. ठीक है, I said Etra take 100 mg and antihistamine take 5 mg. Okay. So, you want me to write or something? Then please message about that. I'll write in the chat box. Okay. So, then what happens? The lesion are characterized by the development of discrete area of opacification, mainly in the superficial layer of the stroma, especially due to the hyaline deposition between the corneal lamellae. So they tend to increase in number, and the epithelium desquamates and relative symptomless and without inflammatory reactions. So they progress slowly until the vision becomes seriously impaired, usually above the age of 40 years. Once this occurs, treatment is best by keratoplasty. A few main forms have been differentiated in granular corneal dystrophy, nodular or granular dystrophy of Groinovo, in which the heredity is autosomal dominant and the opacity is of the abnormal accumulation of the hyaline protein. Hey guys, there's one thing I'm telling कि मैं ये dystrophies I'm not going to read. So मैं end कर रही हूँ ये, and I'm going to read first about cataract and then about glaucoma. After that, if time permits, then I'll read these things. These are not very important. I've read the important parts. I'll not read it now. I'll read it in the last. Okay, okay, guys. Bye.